My name is Julie Holgate. My business is Holgate Child and Family Counseling, and it's pretty obvious. Child and Family Counseling, when I was naming it, I wanted it to be exactly what it was. Child and family. I am a mental health provider. I work with a wide variety of issues, couples, young children, families of all kind. We talked a little bit about that before we started. Families can really take on many faces. So I do lots of different modalities in the work that I do. Some of it's online, some of it's in home, which is kind of a lost art, I would say. I would sort of compare it to like when people have play therapy, where you get to watch those in kind of their natural habitat, so to speak. People find that actually quite interesting when I say that I go into people's homes. It kind of is old school, where you imagine like a doctor visit with like an old doctor's bag.
Yeah.
But it really allows for a lot of different elements in understanding the family dynamic, and then helping piece together kind of almost triaging a little bit in what is the most kind of important issue to face first, so that you can support some of the other difficulties families are experiencing. And that's probably most often occurs with like the whole family. So it'll be, a couple and their children. But also if it's just a couple, or if it's just marriage counseling, it can be really helpful to see people at their homes. So that's just one element. Actually, this is great timing. I am opening next month, November 1st, a new office. I will be your neighbor right around the corner.
Really, here?
Right over between Shoes, Cup, and Cork and Lightfoot. So there's
Lightfoot. Yeah, I know where that is.
Some offices over there. So I will be opening a new office next month.
Congratulations.
It's really exciting. It's been a busy year for child and family counseling. So I'm really ready for it.
Yeah, that is incredible. No, really, congratulations to that. That's so cool. The fact that you get to have two locations. Where's the first one?
Well, and so I hadn't been practicing in any one location prior. I was really working with the needs of the client. If somebody needed to fit things in between work, I would meet with them online. If at home was better for them, and even some people who didn't feel comfortable meeting at home, we would find like a meeting space in a more neutral location in town, just to meet their comfort needs and things like that. So
that is so cool.
It's really expanded to the point where having a new office, I think it's critical, and it'll be great to just have one more option for people in terms of what they're looking for.
Oh, absolutely. Mm-hmm. Congrats. So you're going to offer all those goodies like coming in, Zoom, and your office, right? Mm-hmm. Adding to that. Okay, that's cool. I thought you were going to be like, I'm going to get rid of that's great.
No, I'm more expanding just to allow another element, because there are so many, I don't like the word issues, but there are so many treatment concerns that people seek counseling for, and not one size fits all. And sometimes people just need kind of a place to, even leave their home and get a quiet moment, or sometimes some of the difficulties they're facing have a lot to do with what's happening at home.
Yes.
So even having somewhere to go is really helpful. Additionally, depending on the level of treatment somebody needs, sometimes getting up, getting yourself to your appointment, getting there on time, there's a lot of treatment value in that, making that commitment to your mental health and being able to not just turn on the computer, which we're all really used to.
Yes.
And there's a lot of benefit in that, but there's not always, if you're somebody who needs to really get up, get yourself going, the office provides that.
Beautiful. So I love it. And now give me a little bit of a background about yourself. How did you get started? Is this something you've always had curiosity in and wanted to jump right in? Talk to me about that.
Yes. So I would love to say I'm multifaceted. I am multifaceted in terms of the adventures I've been on throughout my life. I have always loved psychology. I've always had an interest in it. I really started out when I was younger. I grew up in a family where there were a variety of learning difficulties, ADHD, which a lot of families deal with today. But I found that I was somebody who didn't have those needs or those differences, which we see so frequently today. And I think we're really fortunate that our diagnostic measures and our testing have advanced so much.
Yeah.
But so that was something that I really was exposed to at a young age in terms of understanding what resources were available in the community. I grew up in Baltimore, which Baltimore County is a lot bigger of a county than Loudoun. It has a lot of resources in terms of schools for children, testing, tutoring, all sorts of things for any kids that have those, needs. And so when I was in high school, I really started reading a lot of books on the side, just about different topics and different disorders, not having to do with kind of kids. Or I actually never thought I would work with children. Originally, you kind of don't think about it, but you just know you like a certain topic. And so from a young age, I really loved just the topic of psychology and the disorders. And then when I went through school, I just learned more and more about it. And it was just straight through. I went through all of my schooling. I got a lot of great experiences coming out of school. I worked in residential treatment coming right out of graduate school, which is very eye-opening. I spent a few years working with children 12 to 18 years old. And so they were in residential treatment, which for people that don't know, this means that the children were actually living there.
Okay.
And so it's quite different now in 2024. But back 20 years ago, you might be living in residential treatment for 6 months to 2 years, which for a teenager from 12 to 18 years old, that's a really important, critical time of their life. So, I got a lot of experience there and, have had the ability to really help on that end with this most extreme end of what disorders some children and girls, for that matter, deal with.
Yeah.
And then, after that, I spent some time in the Baltimore County Crisis Center, which was also very eye-opening and fascinating. There's a huge need there, and that facility was really aimed at alleviating the work that the police do. So especially in Baltimore County, Baltimore City, distinguishing between the needs of somebody who has a mental health disorder when you're a police officer can be really challenging.
Yeah.
So what they would do at the crisis center is they would pair a mental health provider with a police officer, and you were able to help assess the needs of somebody in that way and really support the team and help them understand a bit more what resources that person needed in the community. And so having these two completely different treatment settings really helped kind of broaden my experiences. And at the time, my kids were really young. And so it was less long-term care for patients and more, just really that crisis-oriented moment, helping them get services in the community. And then the next person would come in the next day.
Yeah.
So it wasn't really ongoing treatment. It wasn't until I moved to Virginia that I really worked in more long-term outpatient care, in more of like a private counseling setting.
Okay.
So it really went from more institutionalized care to personalized long-term outpatient care, which is, I have to say, it's a really strong passion for me and a big love.
Yeah.
Getting to really dig in on those treatment issues, see people through the years and their progress and the highs and lows of their life, and saying goodbye to people. And then sometimes when life cycles around and gets hard again, you get that like metaphorical knock on the door and they're like, hey, I need to check in.
Yeah.
And so that's the work I've been doing in a variety of ways ever since I moved to Virginia. So
you've been busy.
Yes.
No, that is a lot of experience. There's so many different moments and eras that you went through, and now you're here and you can take all that knowledge and help even more people. So I think that's incredible. I'd like to talk about I guess being able to diagnose a mental illness. How do you go about that? What are the procedures or the testing that's done?
So that's a great question. You know, there's a term in counseling or psychology for that matter. It's called the here and now. And really what it means is what's bringing them in. What's bringing them to your office? What's the loudest thing in the room that they're dealing with? And it's not to say that they don't have secondary concerns. It's almost like a triage of sorts. It's what's prompting them to reach out. I think there's so much stigma, and obviously that's a whole nother topic all on its own. Good luck finding it in there.
Thank you.
Yep, that's it. So there's so much stigma out there that I think it takes a lot for people to reach out. And so that's one of the biggest things that I want to know is what's prompting people to come to my office or call my phone, email me. And so when someone first calls or interacts with me, that first question I'm saying is, tell me what you're looking for. Like, what are you reaching out for at this time? So that's that here and now piece where they could have a ton of other things going on or secondary, but like what's causing them to pick up that phone. I will have probably like a 15 to 20, 30-minute conversation on the phone just to kind of talk with them, get to know them a little bit, and number one, make sure that I can support them.
Yeah.
One of the things I love about mental health treatment and nearly all mental health professionals that I've ever met is it doesn't matter if it's you that's helping. If there is a better organization, if there's a better therapist, if there's a better program, we're going to connect you with that person. It's not competitive, I guess, in the way that other businesses are. So that's kind of what that initial conversation is about. It's determining, am I the right fit for you?
Yeah.
And then once we have that conversation, I typically will send out some questionnaires, some important screening tools that are really looking at depression and anxiety and kind of how severe it's presenting in that moment. And that's really not to ignore why they're calling me, but to really determine functionality, any safety concerns that are happening, anything that's coming up for that person. Because if you're not functioning in your daily life, if you're not, I know this sounds funny to some, doesn't to me, but it might sound funny to some, but if you're not able to get out of bed or brush your hair or teeth or even eat 3 meals a day, that's a different level of difficulty than somebody who has high stress intensity at work. And both of those things are very important, but they really need to be approached very differently.
Absolutely.
So those are some of the questions that come up for me initially when I'm working with somebody, is to really determine, are we focusing on something as critical as making sure you're eating properly and getting up and getting out of bed and getting to work? Or are we working on, managing your routines and your stress and your schedule? Or, if it's a family, what are the dynamics that are standing out the strongest, that are contributing and having like a windfall on everything else?
Yeah, no, absolutely. On that diagnosis part, is it sometimes maybe can be surprising or shocking to some clients, or I want to say patients, I guess, hearing that they have something and maybe they didn't know, or they're really like, what? Like, I thought this or I thought that, and how do you guide them through that?
Well, so that is a very interesting question, and it's an important question. And I think this varies practitioner to practitioner. Some people will really focus on the name and the title of the diagnosis, depending on what the person is presenting with. And other people will really focus on the symptoms and less on the actual title or diagnostic. So I personally am someone who focuses more on the symptom presentation. If I am discussing a diagnosis with a family or a child or a teen or, a couple, it's typically with the purpose of helping them get the right treatment, helping them be on the right medication regimen if that's necessary, or more of like an educational piece if there's somebody who's struggling with why they're feeling the way that they're feeling. So there's always a purpose in why I would discuss a diagnosis with someone.
Gotcha.
Does that make sense?
Yes, that does. Thank you for answering that.
Sure.
Appreciate it. And then you also like the operations side as well as the therapy. Talk to me about that piece.
So I kind of, since I've been in Virginia, have worn two hats. And anybody that runs their own business knows there's an operations side.
That's right.
When I came to Virginia, maybe it was about 12 years ago, I worked for private practice. It was a private group practice. We joined another one that was bigger. And from kind of the very first day I joined that practice, they asked me, typical interview questions like, what's your 5-year goal? And I was like, I want an administrative role. I want to be helpful. I want to help run the practice. Like I'm very hands-on in that way.
Yeah.
I love efficiency. I love the idea of work smarter, not harder. I like things to just run smoothly and adapt and overcome. And I love problem solving, not just with my clients, but I love problem solving in the business sense.
Yeah.
And so when I joined that practice, I think it was back in 2016, 2017, I quickly took on some supervisory roles there in terms of working with students, those going through their residency. And then I soon after worked with the team and became a partner at that practice and opened up an office out in Lansdowne, which was the first time I had ever done that, which there's been a lot of firsts for me. And that was really exciting, very successful. It did very well. And it was really my first opportunity back then to have my hands in like the day-to-day functioning of an office.
Yeah.
And, the hiring of the staff, getting to know the therapists, working with the students. And it was just something that I loved. And at the same time, I got to continue working with my clients and doing the mental health piece, but also creating a setting that just felt great for everybody, especially a place I love to go every day.
Yeah.
That practice did very well. I could have probably continued doing that for a really long time, but one of our partners did want to retire, and we at that time joined a larger nationwide behavioral health company.
Okay.
And so I took on the role a few years ago as director of operations for their branch of Virginia, for the entire state of Virginia.
Whoa.
So
Big position there, ma'am.
yeah, that was really a huge operations hat. We were working at the time with 300 therapists, psychiatrists, nurse practitioners, residents, and we had a huge team. So we had receptionists, we had operations managers, we had, clinical managers. We had a huge, we really had like a team of hundreds of people.
Wow.
And so for a few years as the director of operations, I unfortunately stepped away from that direct care because there was so much operationally I was working on day in and day out.
I believe it.
And so last August, we've sort of passed the year. I really missed kind of my first love of working directly with people and patients, and I wanted to kind of throw my hat in the ring on my own. And so I kind of finished out everything there and decided I was ready to do things on my own.
Yeah, and here you are.
And here I am.
Right?
And and so we're coming up on the year, which is really exciting.
I know. Already.
And so it's like even a surprise for me sometimes. So it's a lot of information.
No, I love it. We get to know more about it.
it's a long but good story.
Yeah, no, for sure. And I know you said now you're on your own, but since you are opening your office, will it be on your own, or are you bringing on like maybe some help or a team? Talk to me about that.
I would love that. And I still stay in communication with a lot of my former colleagues, just because I think anybody who's worked in mental health understands the teamwork and the camaraderie and, just relying on one another. Just look, it's a great job. It's a great career. It's got its ups. It's got its downs. It's sad points, but having a team available for consultation and that teamwork is something that you can't replace. And so I think it's on the horizon for me. I'm not in a hurry.
Yeah.
I would be happy to have a great team.
Yeah.
But I am enjoying what I'm doing right now.
Yeah. All in due time. When it needs to happen, it'll happen. And yeah, that's exciting. I love that for you. I did want to ask you, where do you see yourself now, today, in the next 5 years?
In the next 5 years.
Personally and with your business,
Well, personally, I have a busy house. I have a busy family. I have 3 girls. I have 3 daughters. And so they're all hitting the teenage years right now.
Ooh.
So in about 5 years, I will be coming to the tail end of the high school reign. So I might be coming up for air at that time. But professionally, I would love to see something similar to what I did before we kind of joined the state of Virginia as a behavioral health company. I would love to see what I was doing kind of before that, where it was a group practice. We had about 65 providers at that time, and just getting to take care of the mental health community, give back with my vision, with my passion, because I think, I know you met a dear friend of mine, Robin Gebhardt.
Yes.
She does Keeping It Real, real estate. She is amazing. And one of her biggest mantras is really about being your authentic self.
Yep.
And I don't believe many people can be successful as a mental health provider if they're not their authentic self. And so any practice that I work for or am in charge of, I really would like to embody all of those elements of just your true self, and you're doing it because you love it and you believe that change is possible.
Yes.
You believe people can get better, they can have better lives. And someone once asked me, not to go on a tangent here.
No, go on a tangent, please.
Somebody once asked me in an interview, what my favorite type of client was. And I thought it was a really silly question at first. I was like, I don't know.
Can you even pick?
I don't have a favorite disorder that I treat.
Right.
But this answer came to me luckily, because I felt very perplexed at the moment.
Yeah.
But it really is somebody who wants help, somebody who wants things to be different. They want positive change. They're open to reflecting on the patterns in their life, things that they've been doing maybe that aren't functioning the way that they want them to, the relationships that maybe don't feel the way that they want them to feel, and how we can modify that, how we can learn new skills at any age of our life. Somebody coming to me and wants and is motivated to work and wants change and wants to feel better, that's my perfect client. And so, that's really what I'd like to do more of that. Yeah.
That was a good answer. That's true. I would be I can't pick a favorite, and what diagnosis?
I know, it was really hard.
Yeah.
So,
that's great. No, people who want change and who want to kind of, excuse the weird analogy, but crawl out of that dark place and hole that they're in and get to the light. So I think that is great. I'd like to know what you hope that your clients, the type of experience they can have when they come to your office. Talk to me about what you hope the type of impact that you have on them can be.
Well, I want them to feel heard, safe, understood. I think we get glimpses of that in our everyday life where someone sees us for who we are, and there's a theorist, and he talks about unconditional positive regard. Have you ever heard of that term?
No.
So I think probably a lot of therapists love Carl Rogers. He's a theorist, and he talks about unconditional positive regard. And so what this means is that no matter what your life experiences are, choices you've made, maybe we make mistakes, maybe we make the best decisions in our life, but unconditional positive regard is this idea that we regard you in a positive, warm, authentic, empathetic, I think that's the most important piece, empathetic light, that we're considering you positively for all of your experiences, good and bad, and your ability to embrace them, really.
It's kind of a little bit of a hard concept.
It is.
I think.
It's big.
Yeah.
It's big, and it's not an easy thing to do.
But you can get there.
You can, and I guess being a complicated person myself, I think that's what I want people to feel. I want people to feel positively regarded no matter what they're talking about in my office.
No, that's good. I love it. I think that's a great answer as well. What are some misconceptions that you've come along the way through all your experience where the stigma has changed for that regarding mental health and the symptoms that people have, like, oh, they're just lazy, or, oh, they're not a go-getter, things like of that nature?
So this is definitely like a loaded question as well. No, I mean, it's a really important topic. And I think this is something I'm definitely passionate about as well. I've seen a variety of different communities, cultures, even countries. I have a husband who is from another country, so I've done some, personal research on kind of how different countries do different things. I think our country and our community has grown so much over the last 20 years that I've been in practice, and I'm proud of it. People are comfortable talking about going to counseling. People are talking about the fact that they're on medication to help their anxiety. And it's not something that we whisper about, in my experience. However, we still have a long way to go. I think one of the biggest things that happened during the pandemic, I think if we're looking for some silver lining, is that the availability and the importance of mental health in our community and what I saw really grew. Telehealth previously was something that very few providers ever did, but because we had a need, we adapted. We provided it. We stepped up to the plate. We gave people services. Even like different states. I don't know that many people know this, but DC, Maryland, Virginia, West Virginia, different states gave each other reciprocity with licensing to help expand the network of the mental health that we provided, which is kind of fantastic. We saw insurance companies waiving copays for mental health treatment, cost shares across the board. We saw organizations, investing in their services for their employees so that their employees could get help. And to me, that helps behavioral health have a fighting chance against the importance we place on our medical health. And I think that that's really what I'd like to see more and more of, is us moving towards, I won't say completely the medical model because there's benefits of us not being completely aligned.
Yes.
But I think the biggest tragedy is somebody who feels like they don't have hope and that there's nowhere they can turn. You know, mentioning those safety concerns that some of the clients I see come to me with, it's a real thing. It's not Hollywood. They really experience it. People commit suicide every day. It's something, you know, personally my family has been touched by, unfortunately.
Sorry to hear that.
And if we can be a link in the chain in making a difference in somebody's life, like, that's really what I hope for.
Yeah, no, absolutely. Thank you for sharing that. Got a little intense there for a moment. But thank you.
That's mental health.
Right?
Yeah.
Oh my goodness. I have to ask, like, how do you handle that? Because I know some stories and some situations for some people is like, it's a lot, right? And you got to take care of your mental health too. So how do you bridge that gap for yourself? Like, how do you know when to, like, leave it at the office or leave it somewhere where, I know the office is funny because, like, I know you haven't had an office for a bit, so just go along with me here.
Well, I mean, you know, that is something I think training in mental health does better than any other career or occupation I've heard of. Nurses, doctors, police, military, they don't do this well. And I'm not picking on anybody, but when I was in school, self-care, it wasn't its own class, but it might as well have been. We did so much work on what's called transference or countertransference, which is when your own issues come into play when you're in the patient room, or when the patient's issues are being reflected onto you. And so the training that you get as a mental health provider, above all, teaches you that awareness of how to know what your limits are, when you need to ask for consultation, you know, your comfort zone with safety in which you need this person to be evaluated at a higher level of care. And that's something, that's a skill that grows and grows the longer you're in the field. I don't think it's ever perfect, and it shouldn't be. It should never be something that you're too comfortable with. You should always be learning, reflecting, trying to figure out, is this something that's clouding my judgment of how I'm working with this client? And to me, I think that's the best provider that you can be, is to know how you're impacted by what you're hearing.
Yes.
Because there is something called secondary trauma, which is, you know, hearing people's trauma stories. You go home at night and you can't unhear those things. So, you know, you really go back to your training and teaching you to care for yourself and get consultation from colleagues.
Yes.
You know, and it's really something that we do well. And burnout is real. So even taking a few years off to be director of operations can help with some burnout if you're seeing too many clients. But, you know, I think that self-awareness is key.
Yeah, no. I'm glad I asked that question because I wonder about that sometimes. And I'm glad that you said that there is training for that because sometimes I've wondered that about, like, therapists, counselors, psychologists, psychiatrists, like, are they able, like, were they taught to handle and take care of themselves? But from what it sounds like, yes. So,
well, and that's a benefit also of working in a group setting, is knowing that you either have a supervisor or you have a colleague with the clinical skills to support anything you're feeling. And we all, in my history of being in this career, have done that for each other.
Yeah, wonderful. I love that. And what type of clients do you have? I know you mentioned earlier, like, the variety of, I keep saying clients because we call them clients or guests, but patients for you.
We actually call them clients.
Okay, cool.
Yeah, we do. And I think I could tell you a very complicated reason for that, but I'm not going to. It's probably not that interesting.
Oh, stop. You can.
No, it's okay. We do call them clients, but I'm so sorry. I forgot the question.
No, tell me about all the variety of
the people that I see.
Yes.
The clients that I see. So as the title of my business, Holgate Child and Family, I really work with a variety of different people, couples, the family unit itself, or individuals. I don't think many people know this, but about only 10% of mental health providers work with children.
I thought it was a lot more than that.
Well,
I'm shook.
It's not very large at all.
Dang.
And although maybe I will give you, maybe it's crept up to 12 to 15%, but it's very low. That's really the message I want to let you know. And so
Dang.
it's very complicated, but you're working with so many different people, so many dynamics when you're working with a child. Really understanding the relationship between all family members. But I love it. I really love the interpersonal play between a mother and a child, a mother and a father, a mother and a mother, siblings. I find it really like something I can sink my teeth into in terms of helping everybody impact each other. And sometimes it's really about picking up one major thing that's impacting everybody. The family can be so complicated.
Yes.
And sometimes what we think is the problem is not the problem. And so, having said that, I also like working with one person. It's totally different level of intensity when it's one-on-one.
I bet. Oh my goodness. Like it's like you have to pour for me, like without maybe somebody that I want to have a conversation with or let them do the talking, like I gotta say stuff now. Like it's on me. And sometimes I'm like, let somebody else talk. But yeah, no.
So it's really a wide range. I know most people will say you should narrow your treatment population, but I do like seeing a variety of different clients, and it also helps diversify, how you cope. You asked, how do we cope with it, or how do we deal with it? If you're seeing a variety of different types of clients, couples, kids, it also helps you focus more on a smaller group of that treatment issue. And it, in my mind, helps me reduce burnout.
Wow. And that's good. Love it. You're just like finding ways like, okay, let's diversify. Like finding that good balance. No, it's important.
No, the balance is definitely important.
Yes. Is there anything that I have not touched on, like as far as yourself or about your business, that you would like to share with our listeners? I want to make sure I get everything.
No, I mean, I've said this, and I guess it's just important enough to repeat. I think in the future we might have like a new term for our mental health, because of maybe the stigma attached to it, the term mental health. But it's really self-care. It's how do we process our lives, the things we've been through. And I would just encourage anybody that's listening to this, just to understand that whether you're going through something that you consider small or medium problem that just affects you every day, or whether this is a lifelong struggle that you've had, it doesn't have to feel this way. It doesn't have to be this hard. There are people that care and can help. But I won't lie, counseling is work. Like, you got to show up for it. So I would just encourage anybody who needs help to reach out.
Absolutely. And you have an office coming here again.
Yes.
Circle back to that here in Leesburg.
Yes, I'm so excited about it. It's going to be right between two Leesburg landmarks, Lightfoot Restaurant and Shoes Cup and Cork. So it's 15 North King Street. And it's, I'm very excited about it. This is my favorite part of Leesburg. I love the walkable streets and just being able to pop out for lunch.
Right?
So,
exactly.
Starting this month in November, new office.
Exciting. Do you have a name for it yet? Is it going to be your name?
It's going to be Holgate Child and Family Counseling.
Beautiful. Love it. All right. My final question. Last one, I promise. I know I'm just like...
It's okay. Keep
Thank
them
you.
coming.
or a saying or maybe even a mantra that's inspired you or that somebody's told you in your life, if you wouldn't mind sharing that with us and listeners to use as inspiration.
Well, I will go ahead and quote my dad.
Love it.
I'm sure he'll be laughing at this, and my mom will be like, "Why didn't you quote me?" But little family dynamics there. I used to hear all the time from my father, "Tomorrow's another day," and it seems so obvious, but if we didn't like how today went, or we wish we had pushed a little harder, or we wish we had done something or said something different or conquered something differently, the fact that we can recognize it when we go to bed at night and we can say to ourselves, like, tomorrow's another day, I can try again. And to me, that's something that's always helped me.
Yeah.
And I really think that if others could use that sort of thought process, they would be less harsh with themselves when they go to bed at night.
Yeah.
When they reflect on their day, because understanding what we want to do differently is more than half of the problem.
Mm-hmm. Yeah, no. And you know what's crazy? It's like, it's said so simply, but it's just so hard. Like, yeah, tomorrow's another day. Some people can be like, oh, tomorrow's another day. But it can be like, no, tomorrow is another day. Like, another opportunity, another chance to change something you didn't like. So I think that's very powerful. Thank you so much for sharing that.
Well, thank you so much for having me. It's been a pleasure.